Thank you, Dana. Brushing your teeth is not just good for your teeth and your breath. It might also protect your heart. We're taking your medical questions today for Dr. Zorba Pastor.
The number to call, 270-9933. And Dr. Pastor joins us from his clinic in Oregon. Hi, Zorba.
Hi, good to see you guys.
Interesting study, brushing your teeth and heart disease.
Right, exactly. Well, for years we've been talking about heart disease, brushing your teeth, talking about the bacteria that are in your teeth and how they might affect your cardiovascular system. And this study came out of European Society for Hypertension and Cardiology, and they looked at whether or not people who brush their teeth on a regular basis 2 or 3 times a day, in other words, morning and evening or morning and the middle of the day and evening, had less heart disease. And lo and behold, the ones who were actually brushing up to 3 times a day had up to 10% to 15% the lower risk of heart attacks, even and maybe even stroke, compared to people only brushed once a day. And I find this really, really interesting because brushing your teeth, flossing your teeth are really important for good nutrition, especially as you get older and your teeth are more likely to have problems. But now we know that brushing your teeth up to 3 times a day might also be good for your heart. It's another reason to get an electric toothbrush this Christmas, because they are far better than a hand toothbrush, because you push the button and you brush your teeth for 2 minutes. That's how long it stays on, which is really how long you should brush your teeth. And don't forget to floss.
Absolutely. You sound like my dentist, not my doctor. All right,
I'll go to dental school next.
Okay. Let's go to the phones. We'll start with Cliff in Hanover. Hi, Cliff.
Hi there. How you doing?
Good. What's your question?
Well, I've been having a lot of skin tags lately. I'm 66 years old, and I've been dealing with them for a number of years. What can a person do to get rid of them, and how do they stop coming back?
Oh, sure. Well, first of all, you can't stop them from coming back. They're generally genetic. If somebody else in your family has them, you'll have them too. And the best way to get rid of them is to go to a doctor's office and you have them snipped off. That's how you do it. Either they're shaved off, they're snipped off. And for some people, especially when they're under the arms, which is often where they are, they can really be bothersome and uncomfortable. But that's the way to do it. And sorry, I don't know of any treatment to actually keep those skin tags from happening again.
Oh, interesting. All right. 2 lines open at 270-9933. Let's go to Dan in Lodi. Hi, Dan. What's your question?
I went to the VA on my last checkup, and they had a gal sitting in the lobby, and she was saying about oil pills, how they it was down for a while. Now they believe that does have a help as far as Alzheimer's disease. Is that true, or is it still about the same?
I don't think fish oil has anything to do with Alzheimer's disease. We don't know what causes Alzheimer's disease. What we do know is that people who have an Alzheimer's disease and other forms of dementia, we know that people get their blood pressure under control, their cholesterol under control with a statin, who exercise, who eat a good Mediterranean diet. They have a lower risk of dementia and actually have a lower risk of Alzheimer's disease. Eating fish twice a week is also useful. But fish oil, I don't think there's any proof, any shred of proof that it works for Alzheimer's. Not at all.
Interesting.
Sorry.
All right. Let's go to Christine in Madison. Hi, Christine.
Hi. I have sleep apnea, and I have a CCAT machine, but I got this thing called the Soul Clean machine. Mm-hmm. When I use it in the morning, my glands are so swollen. My face is swollen.
Mm-hmm. Sure.
I'm just wondering, is that normal or what?
No, I wouldn't consider that to be normal, but it is a side effect if you have a sleep apnea machine. What you want to do is call your sleep doctor, and you want to make sure that you go in and get new equipment. And new equipment doesn't mean the machine. It's usually a matter of the mask and the type of mask that you're actually using. You've got to have a well-fitted mask to make it work, but there are different types of masks based on your face. So call your provider, get a different mask. It's not normal, but it is something that does happen.
All right.
All right. Let's go to Sue in Oregon. Hi, Sue. What's your question?
Hi. I am calling about my mother who has dementia, and she is due for a colonoscopy, of which I would rather not see her do. If she goes in for the colonoscopy, they're talking about putting her under and doing the regular colonoscopy.
Right.
The last time she went under anesthesia, it was not good.
Yeah. Don't do a colonoscopy. You're 100% correct. She has Alzheimer's disease. Why do you want to do a colonoscopy with her when she doesn't have a quality of life? And why do you want to put her to sleep when she's had side effects? Cancel it. Don't get it done. Good example of over-testing, which a lot of us do, a lot of physicians do. I sometimes do it and can't, have to stop. Absolutely cancel the test. There's no reason to do it.
Oh, good. That's reassuring for her to hear, yeah.
All right, Jim in Sun Prairie. Hi, Jim.
Yeah, hi.
What's your question?
I have sciatica in my hip, very bad. It's been for years now. And it's got to the point, I'm 54 years old. It's getting to the point where I can't even be active. I have a long history of being on prednisone for Addison's disease. And they finally diagnosed me that I don't have that, and then it's just sold as prednisone for about 18 years. High doses, and they're getting me down now to like 15 milligrams a day. And it seems since I've gone down on my dose, my body's just really starting to hurt all the time. And I've tried physical therapy. I'm on
Sure.
drugs from the
Well,
doctor.
I'll give you some suggestions. First of all, getting down on those prednisone pills are really important, but then your body will tend to ache more. So you want to, once you get off the prednisone, you want to start to use anti-inflammatories. But while you're on it, you can't. So 2 arthritis strength Tylenol in the morning, 2 in the evening when you go to sleep, 2 in the middle of the day. Physical therapy. Those are the things you have to do. Get a good physical therapist. Water, aerobic exercise can really help with that pain. And it's a tough thing as you go down with that steroid.
It really is. All right, we're out of time. Thank you all for calling in. We'll do this again soon. Zorba, thank you for your time.
Thank you, Zorba. Great to see you.
Take care.
We'll be right back with a final check of your forecast.
Check 3.